Good morning, everyone. I'm very grateful for the PASCOM to give me an opportunity to speak about this particular topic, which for me personally is a personal passion, and most of my professional work in public health and in community medicine has been exposed to working with local government units at the level of the community. So, allow me to first share my slides here. So, as mentioned, I'll be talking about the healthcare system and basically my reflections from the field. I used to before I'm an educator. I used to work with local government units. I was a former municipal health officer and a former doctor of the barrio. In fact, that was my first job. Right after passing the board exams, I applied for the DTTB program and I was deployed in Candoni, Negros Occidental. Then eventually, I became also a municipal health officer, an LGU hired municipal health officer also in Ilog, Negros Occidental. But currently, I am a member of the faculty of the University of St. La Salle Bacolod under the two colleges, College of Medicine and College of Arts and Sciences, under the Family and Community Medicine Department and the Natural Sciences Department. So I teach pre-med students and med students. I'm also a member of the pool of subject matter experts of the Development Academy of the Philippines Graduate School. So I used to handle post grad courses, especially in Masters in Public Administration with a focus on health systems development, and also currently and most recently uh, part of the faculty in charge of the continuing um, health quality health initiatives in the hospitals. So we are doing that certificate program with the development of our Academy of the Philippines. I am also the program manager for the U.S. Department of Defense HIV/AIDS Prevention Program, or DHAP, under the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR. So my specialty now is helping the armed forces of the Philippines develop and enhance their HIV/AIDS program for their personnel in coordination with other agencies such as USAID and CDC, all of which are under the umbrella of PEPFAR. So as an educator, no, I handle community medicine in the med school. So I would like to connect my lecture today and my dialogue with you on these three aspects. No? What some basic principles of management and leadership towards health system strengthening, some teaching and learning activities that would help our students understand and practice intersectoral collaboration, and what is the role of community medicine physicians in strengthening the health system. So I usually try to begin with the end in mind because it helps me guide and connect the reason why we are all doing this in the first place. And it's all about trying to achieve this vision, not just for ourselves, but for our country as a whole. No? So we always wanted to see a more prosperous country, founded on healthy, happy families comprised of self-actualized individuals. No? Individuals who are able to reach their fullest potential in society. And according to the Ottawa Charter for Health Promotion, in order to achieve that kind of vision, one of the resources that we should recognize is having optimum health. Health is actually a daily resource and not the objective for living. That's what the Ottawa Charter for Health Promotion clarified. No? So with that frame in mind, we see the critical role of having quality health uh, help uh, help us individually and as a community achieve whatever vision we have for ourselves and for our community and country as a whole. So, if health therefore is the critical element to achieve this vision, so we have to take a look at our current health system. And I wanted to give a lecture on the current state of the health system but I was told and I was reminded that there will be limited time for this discussion. So this is just an overview, and I am pretty sure all of us are familiar with this already because we are all exposed to the Philippine healthcare system. We know that the Philippine health system has been fragmented since the devolution in 1991, the passing of the Republic Act 7160, wherein the local government units are now responsible and accountable for managing their health service delivery and health facilities and health programs, everything about health, even health human resource, are now under the responsibility and accountability of local government units. This could either be province level or municipal level or city level or even barangay level. While there are some hospitals and health programs and facilities that have been retained by the national government, which means they're still under directly the supervision and direct management of the Department of Health, majority of our healthcare system, our public healthcare system, is now under the local government units. Now, of course, uh, there have been many challenges since because not all LGUs have been prepared to really manage and handle the local health system. Not all LGUs have the resources to maintain the operations of these health facilities under their responsibility. And the LGUs would complain that the responsibility was devolved, but the money remained in national government. Of course, the national government would have a different perspective on that. But nonetheless, what is clear to us and the lessons of the devolution of 1991 is that the LGUs were unprepared to manage the healthcare system. And because of this, there has been a decrease in the quality of healthcare. The services have been fragmented because not all services can be provided by one particular health facility. So patients have to be referred to these certain facilities, which may not be under the same care of the same LGUs. So that is one challenge for the Philippine healthcare system. Uh, the fragmentation also revealed that the Philippine healthcare system is working in silos. So for each disease program, for each disease, there's a program for that. So instead of integrating certain diseases, what government has done is that there are so many vertical programs, and each vertical program would have their own expectations, and sometimes the LGUs could not achieve these expectations and could not really see the overall picture because yun na nga, naging they're working in silos. No? So, dapat sana integrated. So, for example, an example would be why not integrate nutrition across all disease programs? Because nutrition is not only a health outcome, it is also a determinant of health. So, why not, instead of having a separate nutrition program, why not integrate nutrition across all disease programs of the Department of Health? Which means you will have nutrition in maternal health, you will have this nutrition in TB, you will have nutrition in non-communicable diseases, you will have nutrition in oral health. Everything will have nutrition because nutrition is cuts across all disease programs. That's just one example of integrating. Because of all of this structure, because of the structure of the Philippine healthcare system, especially in the way they organize the delivery, healthcare system has become expensive. With the presence of PhilHealth, which is the national health insurance system of the Philippines, what remains a fact is that the out-of-pocket expenses remains high, despite the move and the initiatives to have universal health care. And in fact, even in the law, in the universal health care law, the language used by the universal health care law in terms of health financing is not based on health justice. It's not based on equity. There's a particular section there in the law that states that the more premium you pay, the more services you will receive. And that PhilHealth will only pay for the minimum required uh, payments or packages that PhilHealth will pay and will recognize. So which means if you can pay your premiums more, and if you will pay more premiums to PhilHealth, you will get more services. And 'di ba sa Alma Ata Declaration nasabi na, 'di ba sabi natin sa Alma Ata, health is a right, is a human right. Therefore, it should not be treated like a commodity. Rather, it's an entitlement that you should receive. And that whatever uh, entitlement another person receives, it must be the same entitlement that that the other persons receive. So why the dichotomy? No? Why do we need to separate those? Why do we need to dichotomize our services, our healthcare services, between two groups of people? Those who cannot afford and those who can afford our health insurance. And it looks like it's a government insurance that behaves like a private HMO. So that's really something that I cannot understand with our health financing. That's why there's a fear that even with the UHC law, this injustice will be perpetuated all the more because of that language used in the law. No? And one factor that also driving the expensive, no, the expensive healthcare system is the mismatch in the people who require or in need of healthcare services and of the healthcare providers that are available in our society. A small percentage of those people requiring healthcare services are the type of people who are requiring intensive care or hospital-based care. But majority of the population who are in need of healthcare services are those who are mild to moderately sick, who would not require a hospital admission or who would not require a hospital-based uh, type of care or management, and more of them are actually not manifesting any disease, but rather they are the socially vulnerable and those who have the biological risk and the genetic predisposition. So, and yet, our healthcare professionals available in the health in our healthcare system, a huge percentage are specialists or subspecialists. Well, there are generalists, but there are only a few primary healthcare practitioners. Because you have to remember that not all generalists are primary healthcare practitioners, but all primary healthcare practitioners are generalists. So, and a lot of our population are in need of primary healthcare practitioners. These are the population which I described earlier as the socially vulnerable, the ones with biological risks, and the ones with the genetic predisposition. So these are the people who have not yet manifested the disease, but would require the intervention from the primary healthcare practitioners in order for them to stay healthy and to stay far from the illness that they should be manifesting because of the risks. So that requires really the intervention of primary healthcare practitioners. But it looks like at the current health system that we have, there is no there has been no space even for generalists in this system. So all the more for primary healthcare practitioners. So I guess with this kind of health system, it's now expected that the quality of healthcare that we receive will not be the most optimum. And therefore, if we don't have that resource, then it would be very difficult for us to achieve the vision that we earlier had in mind, right? So it's very important, therefore, that we need to uh, reform, transform, re-engineer our Philippine healthcare system in such a way that it should be serving the people and the right people at the right time, given at the right moment. So and with the push for UHC and the aspiration to have all our graduates in med school becoming as primary healthcare practitioners in the future. It is very important as well for us in the academia to make sure that these graduates will be capable enough to confront the current health system and to contribute to its reformation and transformation. and reengineering. That's why it's very important. So what have I learned as a community medicine practitioner and someone who is also involved in public health, right? One major lesson that I really learned was we need to really shatter the messianic complex because there's a tendency for us, especially doctors, there's a tendency for us to know the solutions ahead and to regard ourselves as the one who can provide the redemption of the community. And it's very, very tempting, especially if you are a young doctor to the barrio assigned in this area, especially coming off from med school or from the board exams, and you feel like uh, studying ahead of your deployment. You seem to know very well your community where you will be deployed. But again, with this kind of mindset, it is one of the many barriers that we should help our future practitioners to confront and shatter. Because once we enter the community with the Messiah complex, no? Believing that we know what's best for the others, it will really lead to an irrational impression that we are really helping, which actually we're not helping. And most of the time, if we have the messianic complex, there's a tendency for the community to be seen as somebody who is more dependent on us rather than as somebody who is equal with us and as our uh, essential partner in the quest for achieving that vision that we wanted, that the community and us uh, will share and co-create with. No? And of course, related to the first step was really to spend a lot of time investing in trust building. Um, we have to remember that we are not from the community and we will always be treated as the outsider. And of course, being the outsider, there's always a tendency for people in the community to always question our purpose, to always be cynical sometimes with our intentions and motivations, why we want to partner with them and why we want to work with them. For some of these communities, they've been exposed to many groups before us, and a lot of the groups have been working with them, and sometimes they've been jaded already because in the past maybe some of these groups have somewhat uh, pumped up their expectations but were not able to deliver, so they were frustrated and disappointed, and then of course they become jaded and cynical at the end. So being an outsider, it is really something that we should be aware of once we come into the community. And that's what I always emphasize on the first day with my medical students. I would always tell them that you need to spend a lot of time with the community because spending time with the community is just one of the many things that you can do in relation to trust building, because you have to get to know your community and your community must get to know who you are, because that's what I always tell them. People don't care how much you know until they know how much you care. So you really have to allow your community to get to know you, to get to know who you are as individuals and as people, as persons. And then that's where and then the only way to do that is to really expose and immerse yourself in the community. So that's part of trust building. No? Trust building is really something that trust is the currency of leadership, and you cannot transact with your community. You cannot engage your community without that currency. It is the currency that you pay to your community. So that's very important. Trust building is very, very important. And of course, once you were able to establish the trust with the community, now we go one step deeper in our relationship and journey with our community. And that is really to clarify the problem with the community. Because sometimes we feel that we know more than the community, but of course, that is something that we already were able to bust, no? To debunk. So the community knows more than us because they are the community. So they know what their problem feels like, they know what their problem looks like from their perspective. It may look different from where you are, it may feel different from where you are, but that does not matter. What matters most is how the problem looks like from the perspective of the community, what the problem feels like from the perspective of the community. So it's between what they want and what they need. You have to start with what they want, what they expressed that they want to happen in their community, they want to achieve in their community. Well, there's another school of thought here that some of my mentors would tell me that instead of looking at the problem, why don't you start uh, uh, capturing the vision of the community? What does the community aspire for at the end? What is the vision of the community for themselves as a community? So maybe instead of concentrating and focusing on the problem, we try to go beyond and say maybe describe what you want to achieve for your community. So it's more framed in a positive perspective, and uh, and if that is more framed in a positive perspective, there's a tendency for the community to be less guarded when they participate in that discussion. No? Because it's framed in a more positive positive perspective rather than from a more negative perspective. Because if you start with looking for problems, maybe the community might try to feel defensive, no? Kasi problema, eh baka natatakot silang erase yung problema, di ba? Baka kasi for what we don't know the dynamics of the community. But if you want to start right, maybe we can start with so ano pong gusto niyong mangyari sa community ninyo? Ano yung inaasam nyo? Ano yung mga vision nyo? Ano yung mga hinahangad nyo para sa community ninyo? Because it's more positive, mas less defensive ang community when they share their ideas and their thoughts about it. So that's also one approach that we can do. Then, of course, once the problem or the vision is clarified, no, that's where we start engaging the community. So ano pong mga kailangan nating gawin? What are the steps we need to do and that we need to take in order to address the problem or in order to uh, arrive at that vision that we want for our community. And in every step of the way, dapat makita natin na kailangan i-engage ng community hindi lamang yung sarili nila, kundi lahat ng pwede nilang ma-engage. Itong sinasabi ng UHC na whole of government or whole of society approach. So the entire community, the entire government must be involved in the coming up of solutions to the gaps and problems or to the coming up of strategies and steps, no, that would lead them towards achieving the vision that they want. So we have to build a coalition of champions po. Yun po yun talaga yung one step to sustainability. Kasi po kailangang merong ganito para para kasi hindi naman lahat ng resources nandyan para sa community. So limitado din yung resources nila. Limitado din po yung resources ninyo. So kailangan din po natin na dapat ma-realize ng community na ma-achieve lang ito ang lahat ng mga gusto nila, yung vision nila, kung may engage nila ang lahat na pwedeng ma-engage. Of course, hindi lahat ng stakeholder kailangan ma-engage. Kaya nga merong step po na stakeholders analysis. Kasi hindi lahat ng stakeholder kailangang ma-engage. Kasi ang downside naman, kung lahat ng stakeholder ma-engage in the same way, in the same manner, baka ma-overwhelm din po yung community. Magkakaroon ng fatigue din yung community, di ba? Yung donors fatigue. Di ba yung parang na-overwhelm silang daming tao tumutulong sa kanila. Hindi na nila alam kung sino talaga yung kakausapin, sino talaga yung kung saan talaga sila makikipag-ugnayan or something like that. Kasi nakaka-overwhelm din. Pag na-overwhelm yung community, they do not see themselves, they do not see their value na. Kasi marami na eh. They have to know that they have to be the ones driving the entire thing. Pero kung marami, at pare-pareho yung level of engagement, baka hindi na, mas hindi siya makakatulong sa community. So very important po yung stakeholder analysis. At merong matrix yan at merong template. Maraming tools at instruments for you to identify and categorize your stakeholders. Kasi meron mga stakeholders na talagang kailangan yung ma-engage in a way na talagang kailangan nilang part sila ng resource mobilization nyo. At meron namang mga stakeholders na kailangan na nila ma-engage but sila lang yung mga tipo na kailangan lang natin silang bigyan ng informasyon. Yung mga ganon. What we do is just we give them the information. We don't expect them to really move for us, to move resources for us, but all we need to do is to engage them by giving them the information that they probably need and to help us disseminate that information. No? So may mga ganun po. So for example, media, no? Vloggers, yung mga ganun po. Kasi po hindi naman sila kailangan talagang mag-resource mob. Baka kailangan lang nila i-disseminate yung information para mas maraming nakakaalam. So yun yung importante. So that's their engagement. So then we give them the information or something like that. So depende po sa stakeholder analysis na yan. Maraming tools and instruments dyan. No? May mga workshops kami ginagawa para dyan. So given all of this, no? So anong nare-realize natin? Kailangan talaga ng mga skills that every future primary healthcare practitioner must learn. No? And that starts really in our classroom, no? And in the community where we work. And isa dyan sa mga skills na ayaw ko silang sabihin na soft skills. Kasi pag sinasabi nating soft skills, minsan na-dilute yung value nila. Diba? Kasi there's a tendency for us to differentiate soft skills from hard skills. Yung hard skills, ito yung mga let's say, clinical skills. No? Ito yung dapat marunong siyang kumuha ng BP, marunong siyang mag-insert ng IV, marunong mag-insert ng NGT, marunong mag-insert ng polycatheter, so on and so forth. Marunong mag-intubate, blah, blah, blah. These are the hard skills kasi nakikita siya, hard siguro kasi nakikita siya at to some degree na may measure siya. No? But the soft skills kasi parang hindi siya overt. No? Parang importante din siya pero hindi siya obvious, parang ganon. Baka siguro yun yung ibig sabihin nila ng soft skills. But ako personally, I don't use the word soft skills because yun na nga, it dilutes their value kasi they are equally important. They're equally as important as the clinical skills of our med students. Kasi yun na nga kailangan natin eh, di ba? So ano nga sabi natin, kailangan natin mag-trust building sa community. Kailangan natin tawag dito makipag-ugnayan sa komunidad, no? Hindi sa pakikipag-ugnayan sa komunidad, hindi mo naman kailangan ng masyadong hard skills yan. Quote and quote hard skills. Ito yung mga leadership skills na kailangan natin, no? As hard as they are, as hard as the clinical skills that we teach our students, no? For example, active listening po. Kasi listening po is a critical ingredient for trust building. How can you learn from your community if you do not listen to what the community is telling you? So yun po, so yung mga med students ko, we do a lot of these exercises in school, no? On listening and dialogue. So marami akong mga pa-activities sa kanila and always synthesizing every activity and making sure that they learn the importance of listening and yung ganung skill. And then when we go to the field, yun, we give them a lot of these opportunities. So yung picture dito sa kanan ninyo, these are students, these are my med students who are actually interviewing PWOODs, no? They are interviewing and interacting with the persons who use drugs. And this interaction that they have are being used by the rural health unit as a basis for the design of the community-based rehabilitation program for these PWOODs. No? So they do interviews, no? And of course they come in pairs para at least they learn from each other, no? So maraming mga ganyang activities silang ginagawa. At isang realization nga dyan ng isang estudyante, after the activity, tinawag ko lahat sila, ano po yung so sabi ko sa kanila, ano yung mga insights natin, ano yung mga natutunan natin today, ano yung mga based sa interaction nyo with the PWOODs, no? Ano yung mga lessons na natutunan natin. And there was one student who told the group, no? Well, he was quite emotional kasi sabi niya, it was really a change of perspective, doc, sabi niya. And then he told the class that his family was a victim of a crime committed by allegedly by a person who used drugs, no? So parang ganon. So at that time, iba yung tingin niya sa kanila. But because of this interaction, nagbago din yung paningin niya sa mga taong ganito. So, yung mga ganitong activity, baka hindi lang sa active listening, may mga tinutumbok din sa mga skills of empathy, di ba, yung being able to see the perspective of the other person. So, yung mga ganong activity po. Importante importante din po na ma-realize ng future primary healthcare practitioner na yung kakaharapin niya ay isang komplikadong sistema. It's a very complicated system. A system that is also interacting with other systems, no? Health system in interacting with the political system, with the economic system, with the educational system, with the other systems out there. So yung ganung sistema po, kailangan niyang ma-confront 'yon. At kailangan niyang makita at ma-appreciate yung ganung buong picture, no? So dapat marunong yung future primary healthcare practitioner na mag-zoom in and zoom out para makikita niya yung buong picture at makakatutok sa mga ibang detalye. So systems thinking po ay isang mahalagang skill din. At yan po yung mga kailangan nilang matutunan, no? So kaya po sa med school, we do a lot of exercises on systems thinking, no? And there are so many tools out there. I personally use the interrelationship diagrams, no? As a way to illustrate the complexity of a system. So, yung mga estudyante, merong case study. So, yung mga lumang cases pa noon, yung mga kwento ni Rosario. Pero ngayon, we do a lot of cases na rin na iba. So, I sometimes let them watch a video, no? Para mas makita nila yung mas may visual impact sa kanila, no? Yung case, no? And then, they simulate the analysis of the case using, let's say, an interrelationship diagram, which is an example that you can see in this side of the slide, no? So they see there and they try to analyze with the group, and then they discuss it, no? And then what's good is when they go to the field or when they go to the community, most of the time they also use this tool with the community. So they also teach the community how to use these tools when they want the community to analyze their own situation. Or depende rin kasi for example in this picture here sa inyong kanan, no, because they gathered all the young people, the young members of their community. So tinuruan nila instead of the interrelationship diagram kasi medyo sophisticated yung diagraph na yan. Yung simpleng problem tree analysis yan. Tinuro nila sa mga bata para ma-visualize ng mga bata kung ano yung mga nakikita nilang mga issues at problema sa kanila sariling community, no? At yun, tinuturo nila yan. So, of course, bago nila ituro yan, dapat pagdaanan muna ng mga estudyante. So yan, there's so many tools out there that you can actually use and teach your students. For example, yun, yung itong tatlong ito are just the common things that I personally use in the classroom when I discuss systems thinking po. And then, of course, we use different models like the iceberg model, yung mga ganun po. So, maraming mga ganung issue. Then, dapat, especially a future primary healthcare practitioner must learn how to communicate. Kasi importante po yan. No? It's a leadership skill na it's a premium leadership skill that you cannot do away without. You cannot be a leader if you don't know how to communicate. Because it's through communication that we influence people. No? So that's why in med school, we do a lot of simulations. No? So yung pictures dito sa inyong kanan ay mga med students natin na niro-road test nila yung ginawa nilang modules sa fellow med students nila. So they would simulate they would do practice demos of their lesson plans that they created bago nila dalhin sa community. So for example, if they are planning to design a discussion or a lecture on dengue, for example, so they practice that, no? They simulate that with their peers, no? And of course, they do a lot of the feedbacking kung saan pa pwede ma-improve. Is it in the delivery ba? Is it in the content? So on and so forth. Before they bring that to the community, which is in this case a pictures ito in the left, no? So for example, in the pictures here, no, uh, it, yung top picture was the picture that they did when they had a leadership summit, no? Tinawag nila lahat ng mga young leaders sa kanilang sarili-sariling communities, and they gathered all of them. They give a lot of inputs, no, and discussions with these people. And of course, the picture below here is a picture with the community that they are partnering with, and they're actually teaching the students a jingle, no, song that an action song on dengue, no, an original jingle, no. And during the activity, they demonstrated the song, the action song, to the larger audience, no? So isa yun sa mga activities na ginagawa nila para ma-engage yung community, no? At hindi lamang information na makukuha ng community, mare-retain pa ng community dahil sa method and the way that they did their information giving, no? And of course, importante din sa kanila as early as at that age, kailangan nilang ma-realize na, yun nga sabi ko, yung stakeholders engagement. Kasi nga, system siya, komplikadong system, hindi kakayanin ng isang primary healthcare physician yan or primary healthcare practitioner na ma-address lahat or kahit ma-address lang ang isang issue ng sistemang yan. Kasi nga komplikado siya. It's a dynamic complexity, it's a social complexity. So it's a different level of complexities. So kailangan ma-realize that the future primary healthcare practitioner must learn how to engage stakeholders and must learn how to do resource mobilization. Sabi nga ng isang mayor na nakilala ko, sabi niya, the problem is not that we lack resources. The problem is that we lack resourcefulness, sabi niya. So it's also about thinking out of the box and also thinking within the box. No? Given the certain limitations that we have, what can we do? Diba? Yun yung thinking inside the box. Eh. Yung thinking outside the box naman is really thinking about doing what you can do, being creative, no, bypassing these limitations and barriers that we have. While thinking inside the box is recognizing the limitations and barriers, but still maximizing what we can possibly do, no, in the community, with the community. So yan, yung mga halimbawa po yan ng mga estudyante. So I'm very happy that some of our students were in fact able to engage as high as the local government, no? Yung mga local city officials, were able to engage them, and it's not just engaging them and inviting them to be speakers. So that's not, sabi ko, kung i-invite mo na lang si mayor or si councilor na maging speaker at taga-opening remarks, hindi yan stakeholder engagement. No, hindi yan stakeholder engagement. But if you challenge them, no, to do something about what the community perceives as a need, no, and something that will help them achieve their vision, so mas maganda yon. Kasi yun yung tatawag na engagement. So in many of their activities, they would engage even the private sector there at mga other organizations then within the community. So and then yun nga, so kaya nga nakakagawa sila ng mga small projects with their community in partnerships with these private sectors and of course with the local government unit, no. So yan po yung mga nagagawa nilang mga activities diyan. Kasi sabi ko nga sa kanila that yung most of the work that they're doing in the community is really under the realm of health promotion. Because when I look at all their action plans, no, for the past how many years I've been working with them, with the students, majority of their strategies are really under the health promotion. So I would clarify to them that health promotion is not just the giving of knowledge. No? Yung mga health classes, yung mga symposium, seminars, hindi yan enough. Hindi yan, it does not follow that when you teach your community to do something, they will immediately do it. You have to ensure that there is an enabling environment to put that knowledge into practice. So kaya when they engage their communities and they work some strategies with them, they don't settle for just a seminar, a webinar, a health class, or a symposium, there's always something that would complement uh, 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 the knowledge that for example, there was a one group whose problem identified was really the hygiene related diseases in the community. So they wanted to teach the young kids, no, the value of hand washing, no, and the proper way to hand wash. Sabi ko, oh, tinuruan nyo nga silang mag-hand wash, pero tiningnan nyo ba ang water source ng community? Do they have access to water in the first place? So baka wala. So walang silbi yung lecture nyo of hand washing kung wala naman silang access to water. So what happens is the community will just be frustrated and disappointed kasi nga they could not practice their knowledge. So of course that group was challenged and they went out there to make sure that the community has at least an access to a Pozo Negro as a water source, no? A deep well, something like that. So they were able to do it, no? And then even after the seminar they did, they even distributed some handmade bar soaps, no? Parang gano'n. So sa mga bata, and then yun, nakakatuwa yung ganong activity. At nare-realize nila na there are certain things that people cannot do, not because that they don't want to do it, but because they don't have the environment and capacity to do it in the first place. So that's really what a primary healthcare practitioner should do to ensure that it's really the complete spectrum of health promotion. It's not just the giving of knowledge, there has to be the enabling environment to put that knowledge into practice. So may mga ganon. So for example, in this picture, the group there who tackled the problem of dengue prevalence in that community taught the community to make homemade mosquito traps, something like that. So parang ganon. So they were designing this mosquito traps, parang ganon, larva traps, something like that para mabawas-bawasan yung mga lamok doon. So something like that. So as simple as mga ganon lang po at ma-realize ng mga estudyante. And I guess all of these insights came from my work as a doctor sa barrio, no? Nakakamiss yung ganitong trabaho, no? Yung being in the front lines, no? Sa lahat ng pictures na to, memorable sa akin yung unang picture sa taas, yung nakasakay sa habal-habal. Papunta kami sa isang malayong sitio na hindi pa nakakita ng doktor for the past 10 years. So kami doon nakasakay sa habal-habal. Yung pinaka-importanting tao dyan ay yung batang ito. Siya po yung pinaka-importanting tao dito sa habal-habal. Kasi hawak-hawak niya, hindi lamang yung mga gamot namin, pati yung baon namin for that day. Sabi ko, maiwan ng lahat, hindi lang ikaw maiwan. Kasi yung pag naiwan ka, pati yung gamot saka yung baon at pagkain natin, maiiwan din. Pati kakainin doon sa taas. So yun, so I had to meet with them and there's a lot of work done in that community that I served, no, as a doctor sa barrio. Kasi nga, yung problema nila doon, sila yung munisipyo o yung bayan na may pinakamataas na maternal mortality ratio sa buong probinsya. Sila yon. At nung dumating ako doon, sila din yung facility, sila din yung health facility na bukas 24/7. Sa buong probinsya, sila lang yung facility na open 24/7. Kasi yung facility nila, walang pintuan. So, hindi masasara. So, bukas lang palagi. Walang pintuan, walang bintana. So, ito sa dilapidated health facility. So, we had to convince the mayor who's here, to do something about it. He was a newly elected mayor. So, he was also very progressive. No? And he also wanted to hit the ground running. So, we had to do a lot of our meetings, our local health board meetings, sa gitna ng kanyang lupain dyan. So we had to talk and discuss with them together with our representatives from DOH, no? Na ayusin unang-una yung structures, no? Yung supplies muna. Kasi I cannot talk about demand. I cannot talk about health seeking behavior kung wala namang health facility. So before even talking about health-seeking behavior, you have to make sure first that the services and the facilities are in place. Yan dapat yung mauna. So sabi ko, Mayor, before I talk about encouraging our mothers to deliver their babies in our facility, we have to make sure they have a facility first. So yun yung mga unang-unang inayos yun at inayos ni Mayor yun at sa tulong ni Congressman, inayos din. So nagkaroon na ng mas magandang facility, mas malinis na facility, no? Malinis na yung facility, may sariling delivery room, no? Yan po yung panahon na wala pang hindi pa uso yung mga bemog-bemog ni DOH. Kami yung nauna. Kami yung mga naunang rural health unit na merong birthing na naka-attach sa kanya. Yan. Kami yung mga nauna doon. So yun. So, and then the year after that, yun na yung nilaunch na ni DOH, PhilHealth yung MCP package niya, yung maternity care package, yun, pina-accredit na rin yung facility na yan. Of course, since kami yung nauna, kailangan naming baguhin kasi si DOH meron din siyang standard na kanya. So, kailangan maraming baguhin dun sa infrastructure lang naman. Pero minor lang naman kasi nakatayo na yung infrastructure eh. So mga minor renovations na lang yung kailangan gawin. Because everything was in place. And of course, we were not able to do it without the help of the entire community. Sabi ko nga, whole of society, whole of government approach. Yung picture na to is when I organized the community, no? Sabi ko, hindi pwede na ang problemang pangkalusugan ay problema lang ng Departamento ng Kalusugan. Bakit? Tayo lang bang apektado? Di ba lahat apektado? Whether you are a healthcare worker, a health professional or not. So everybody is impacted if you have a health problem. Why not engage everybody? So yun yung naging principle behind why I had to organize what we call our Community Health Allies and Reform Team, or ang CHART. Tawag namin yun. At si CHART, composed of non-health professionals. These are also community leaders or people who are perceived as leaders in the community. Teachers, no? Teachers, they're mostly teachers. Teachers and mga leaders ng women's group, senior citizen, of course, Sangguniang Kabataan. I was very involved sa Sangguniang Kabataan sa area na yon. And then sila po yung naging they helped us craft strategies, no, to address certain gaps in the healthcare system of that locality. Kaya po after a year, yung dating top 1 sa maternal mortality rate sa buong probinsya, napa-zero niya po yung maternal deaths niya within a year. At ang dating bayan na palaging nasa top 3 ng mataas na malnutrition rate, wala na po sa top 3. At least nasa top 10, top 15, medyo mataas pa rin, pero at least hindi na siya yung mga pinakamataas sa malnutrition rate. So yun yung mga impact na mga ginagawa natin sa community. So it's really looking at the situation from a systems perspective. Therefore, the approach must also be systems approach. No? So yan po yung mga lessons learned ko din as a community medicine practitioner, as a municipal health officer, and a lot of these insights I translated also into lessons and modules which I also shared with my med students in my class. And then yun, at yun yung mga hopefully yung mga ginagawa na nila sa kanilang mga respective partner communities. So I'm very glad also na natranslate na rin yung mga ganitong insights ko and direct experience po. So ano lang po yung takeaway ko po, kailangan lang ma-realize natin na yung Philippine healthcare system is in need of reform and transformation. And we need to teach and equip the future primary healthcare practitioners with the right skills. If we spend most of our time teaching our med students how to auscultate properly, how to distinguish normal and abnormal heart sounds, breathing sounds, how to perform the proper physical examination, neurologic examination, because these are clinical skills. How much time are we spending teaching our future primary healthcare practitioners the skills na minention ko po? Systems thinking, communication, community mobilizing, resource mobilizing, stakeholders engagement, active listening. So I'm pretty sure that these are no longer should no longer be seen as soft skills. And I'm pretty sure that these must be seen as equally important skills as the skills we teach them in our hospitals and our classrooms in terms of clinical competence. So maraming salamat po sa inyong pakikinig po at mabuhay po kayong lahat.